Good morning, students. In the previous lecture, we have already seen two different methods of contraception. One was a natural method, other was a barrier method. In this lecture, we will learn about the third method, that is intrauterine devices. These are the devices which are fitted within the uterus. If we see the uterus cavity is there, within the uterine cavity, these devices are fitted. They are in the form of especially the T-shaped structure, so commonly known as copper T's. Now, these devices can be only introduced by the qualified doctor or expert nurses. So, these devices are implanted within the uterine cavity of the female. After implantation, she can continue till the pregnancy is not required. Now, if we see, these devices are of three different types. One is called as a non-medicated intrauterine devices, commonly known as lippy loops, whereas the second type is a copper releasing, and the third type is a hormone releasing. Copper releasing are the copper T's, copper 7, and the multi-load 375, whereas the hormone releasing are progesterates and the LNG 20. So, what is the function of the lippy loop? They just prevents the implantation. Whereas if we see the copper releasing and the hormone releasing devices, they suppress the mobility of the sperm also. They decrease the chances of fertilization as the copper is coming out, which act as a agent which binds with the sperm and decrease their mobility. The hormone releasing, they affects the uterus, making it unsuitable for implantation, as well as the cervix. More of the mucus is coming out, so the sperms cannot stay there for a longer time and they come out from the vagina. So these devices are used to delay the pregnancy and for a longer period, and these are not like the previous one. They are not to be used daily or regularly, and this is one of the very common accepted method in case of India, where once these devices are fitted in the female, till she do not want to have a next young ones, it can remain there. If required, it can be replaced from time to time. So these devices, as they are fitted within the uterus cavity, so they are called as a intrauterine devices. I again repeat, they are of three different types. One is a simple loop-like structures, they are called lippy loops, followed by copper releasing and hormone releasing devices. The next method is the use of oral contraceptive, or they are the hormonal preparations. These are nothing but commonly known as the contraceptive pills. What they contain a hormone like the progesterone or the combination of progesterone and estrogen. So they are also either containing a single hormone or they may contain a combination of hormone. What they do, they either prevents the ovulation and implantation, and they also helps in the modifying the cervical mucus. Thus, the sperms, they could not move up to the fallopian tube or retard their movement up to the fallopian tube. Thus, the sperms will become non-viable, reducing the fertilization. Now, how they are administered? Whenever the menses starts in the female, that is for the first 5 days, within that first 5 days, that has to be started and to be taken daily for the period of 21 days. I again repeat, starting from any of the day, from the first 5 days of the menstrual cycle, and it should be continuously taking for 21 days. What they help in, they reduces the chance of ovulation and implantation. Thus, they are reducing the chance of fertilization. But in some of the cases, they may cause some type of allergies or may not be suitable for the female. So, in Central Drug and Research Institute, Lucknow, they have developed a non-steroidal type of a pill which has to be taken once in a week, and it has a less side effect as compared to the normal contraceptive pills. Now, this is known as a Saheli, which is developed by the Indian scientist by the Central Drug and Research Institute, and it, again I repeat, it is a non-steroidal. It do not contain the steroid like progesterone and estrogen as in the other contraceptive pills, and secondly, they have not to be taken daily. They have to be taken once in a week, and their side effects are less as compared to the other hormonal contraceptive pills. Few female can have a problem in taking the contraceptive pills. Maybe they feel vomiting, or are not suitable of taking tablets regularly. So in such cases, the other method used, which again contain these both hormone, that is a progesterone and the estrogen with combination of with or a single, they are called as implants and injections. Implants are nothing but a small diffusible capsules which are implanted under the skin. So these hormones continuously diffuse out into the bloodstream, thus altering their effect, same effect, that is they prevent the ovulation as well as the implantation, what the contraceptive pills are doing. Whereas in some cases the females can be injected these hormone for which can have a longer duration. So they do not have to take in the pill or have to implant. The injections are being injected containing these hormone which last for 7 to 15 days, and they can be repeated like that. So these are the two other methods which are for the longer period they can be used. One is the implants and other are the injection, where the regular pills has not to be taken by the female. The earlier methods, that is the 5 different methods what we have seen, were to have a gap between the children's or to stop the pregnancy or the fertilization if not required. But there is another contraceptive method that is called as an emergency contraceptive method. This is again a combination, same type of combination but in higher doses. These are commonly called as emergency contraceptive, should be taken within 72 hours of coitus or the sexual act. They are generally done in the cases of the rape cases, or if the individual feels that their contraceptive method has failed or they have not used any contraceptive methods and they do not want the pregnancy. In such cases, there are the certain types of the emergency contraceptives which helps them to carry out the same process, that is they prevent the implantation, thus even if the fertilization will take place or chances is there, they will retard the process of implantation. The last method of contraception is the sterilization or the surgical method, also known as a terminal method, because this is done in such cases where the young ones or the individuals do not require more young ones. If in such cases, what is done, that is the two methods are there. One is a vasectomy, other is a tubectomy. A vasectomy is applied in case of males, where a small portion of vas deferens is removed and tied up on both the sides by cutting in between, as you can see in the picture, and they are tied in the region of the scrotum. So they are tied with the nylon thread so that the sperms cannot now further move towards the seminal vesicle. Stimulation ends, as a result of which the testes, they retard the formation of the sperm. The semen which is coming from the penis of the male do not contain the sperm cells. They may contain the other fluid, but the sperm cells are not there. So in case of the female, the method is known as tubectomy, where a small portion of a fallopian tube is cut and removed, and it is tied, as you can see in the picture, it is tied on both the side, but this requires incision or cut in the abdomen, so it is more complex as compared to that of a male. Male, it is in the scrotum sac, which is already outside the body. So these both method, again the egg which are released from the ovary cannot, or the sperm cannot reach in the fallopian tube, there is no chances of fertilization. So these both methods, they block the transport of gamete and thus prevent the chance of fertilization. But remember, this is a terminal method when the individual do not want to have more pregnancies. In such conditions, only these method is applied.